Are you currently suffering from pain on the outside of your elbow that's exacerbated such things as opening a jar or holding a cup? If so, these are common symptoms of tennis elbow, or the medical term lateral epicondylitis, and it's a condition that affects your common extensor tendon. For those who don't know me, my name is Dr. Zach Grid here at Performance Sport and Spine in Seattle, Washington. And stick around as we dive into what this is, why with tendons you don't always want to rest completely and modification is the key, and then why exercises are better than anti-inflammatories to get you out of pain long term. With tennis elbow, it's going to affect this common extensor tendon of your forearm right below your elbow joint. And these muscles extend your wrist as well as help with gripping and twisting. Now it's about going to affect 1 to 3% of the population, and it's most common in 40 to 50 years old. Probably an age component there. With tennis elbow, it's 7 times more common than golfer's elbow, which is on the inside. And contrary to popular belief, tennis elbow is actually more common in people that have repetitive jobs or occupations than just playing sports. So you don't have to play tennis to get tennis elbow. It's more of a colloquial term. Though if you do play tennis, there's about a 50% chance that you're going to suffer from this at some point. How do we get tennis elbow? Well, there's several different reasons. So the first one is just this overuse or repetitive strain, doing too much on the tendon with gripping, twisting, or pulling, maybe at the gym, maybe at work. The second reason is we're just increasing our activity too much. We've done too little for too long, and then we do too much too quickly, and the tendon can't handle it. And then the last is like maybe trauma or a fall. Maybe you're at the gym and you grab something and you slip a little bit, and that acute overload causes a strain to the tendon. That can cause it. Now we know what caused it, let's talk about what it feels like. And the most common presentation is pain on the outside of your elbow that's sharp and stabby, and worse with loading or sudden movements. Now this pain may radiate down your forearm into your hand, and sometimes weakness is associated with it. Often things like holding a cup, opening a jar, or pulling on your shoes will be painful, especially in the moment. Now there's 3 categories of tendon pain that are really important to help differentiate it from other things. So the first is tendon pain often gets better as you warm up. So when you first start doing something that might be really painful, but after a few minutes you might find that the pain has reduced some. Number 2, it's load dependent, which means the more you do, the worse the pain is. So if you're doing something at 20 pounds, if you do it at 40 pounds, it's probably going to be about twice as painful. And then lastly, it's better with rest. When your tendon's not being loaded, your pain should feel better. And there's good news and bad news with tennis elbow. So research has shown that 90% of people will feel better within 1 year, independent of what they do. However, initially, this can be somewhat hard to manage, and it's more about activity modification than some single treatment is just going to fix your pain quickly. And since tendon pain can be so intense and feel kind of like nerve, it can really scare people. But if there's one takeaway with this, when you're dealing with tendons, you have to think about modification, not complete rest. Because what happens is if your tendon is irritated and you don't do anything, your pain will probably get less. But you're really about avoiding the provocative activities, and the tendon will get weaker. And then when you get back to doing those things, your pain's just going to spike up. So we're going to go over some common things that we found that people can modify. So when you have tendon pain, you got to think about doing less, not complete rest. So some things to think about is if you're carrying grocery bags in and it's too painful, don't do 2, but just do 1 instead of none. If you're walking your dog, maybe only hold it on the painful side 1/3 of the time, and then put it on the non-painful side 2/3 of the time. If you're opening a jar, try to maybe open it initially with the non-painful side and then hold it with the painful side to slowly adapt that tendon. Then lastly, with things like weightlifting, you still want to go to the gym, but you're going to have to temporarily reduce it. So say you're doing curls at 30 pounds and this is too painful. Go down to 15s and maybe there's some discomfort, but you're not grimacing and it's tolerable. Or things like chin-ups. A pull-up's going to put more stress on the outside of your elbow. Well, maybe a chin-up will put more stress on the inside, so maybe you modify that for a while, and then over the subsequent weeks or months you can add chin-ups back in. But again, find a way to still do it, but you're going to have to modify and do a little bit less than you currently want to do. We're going to show you some stretches that can be helpful for reducing the pain temporarily, but it's really important that you do the activity modifications and the rehab exercises as well. So the first one's going to be to strengthen those extensor muscles. So you're going to have your elbow straight, you're going to pull your wrists down towards your body. Now again, you're not pulling as hard as you can. You want to feel some mild discomfort, but we're going to hold it for 30 seconds, and you want to feel stretch on the outside of these forearms by pulling your wrist towards you. One's going to do the wrist flexors, and the idea here is loosening everything up, helps take compression off that tendon. So elbow straight, we're going to pull our fingers up towards the ceiling and then back. But this time you want to feel tension on the underside of your hand and forearm. Now pull back firmly but not aggressively, and hold for up to 30 seconds. Last stretch is for the tricep or the muscle on the back of the upper arm. So we're going to reach up over our head, place our other arm on our elbow, and we're going to push back at a 45 and then hold the tolerance or to 30 seconds. You should feel stretch again right here on your arm, and that will help loosen up the tendon of the elbow. Now we're going to cover the rehab portion, and we're going to start with isometrics, which means that you're going to be under tension, but your arm isn't moving. Now these are best if people's pain are really high. You can skip to the other ones, but if you feel like those are too advanced, start with these. So the first one is you're going to have your arm at 90 with your elbow to your side, and then place your hand on your wrist, because we're trying to strengthen this extensor tendon. And you're going to push your hand into your other hand and hold for 45 to 60 seconds. So again, you're trying to press your hand outwards and hold with the opposite. Now some discomfort's okay, but it should be mild and you should not be grimacing. Hold and feel tension on the outside of the forearm. In that same position, we're going to do resisted rotation. So what we're going to do is make a fist with your elbow to your side and have your other hand on that hand. And we're going to try to rotate our right hand, in this case, to the right clockwise and hold it with our left hand. So you again should feel some rotational torque through your forearm, and again try to hold up to 45 to 60 seconds. Some mild discomfort is expected, but it should not be painful. This is one of our favorite exercises for tennis elbow, as it strengthens the tendon as well as the whole connective chain and your shoulder. So what we're going to do with a PT band stepping on the same side, have your hand in a knife position with the PT band around your index finger. And what we're going to do is we're going to press our hand outwards, and as we do that, we're going to rotate so our palm faces down, pause, and then return to the starting position. Now this can be quite challenging, so you may only want to go part of the way at first, and then build up the full range of motion, but keep constant tension and slow tempo. 1, 2, 3, 1, 2, 3. Resisted wrist extension. So with your forearm supported, holding a light weight, we're going to raise our wrist and weight up to the ceiling. 1, 2, 3, pause, and then return to the starting position. Keep your elbow slightly bent, as that can take some compression force off the tendon, but 1, 2, 3, and then return to the starting position, feeling tension on your outside forearm. Resisted rotation with your forearm on that bench again and your elbow slightly bent. With a lighter weight, we're going to hold it on the end. You can also use a hammer and rotate 1, 2, 3 as far as you can, pause, and then return to the starting position. This one can be quite challenging, so start light and work up. But remember, slow tempo, full range of motion, pause, and then return to the starting position. And to strengthen the shoulder, we're going to do the bent over roll. So with that same light dumbbell, we're going to bend at a 45 with our hips. With our elbows straight, we're going to raise our arm up to the side as far as we can, and then return to the starting position. Remember to keep your elbow straight and force through your shoulder, and don't arch your back. So put your other hand on your leg to support, raise up, pause, and then return to the starting position. So when we hold the dumbbell like this, it puts more stress on the inside of the tendon, the golfer's elbow part, that isn't affected. If we hold it like this, it puts more area on that common extensor tendon, which is the one you're dealing with. So a row like this, that your arm is supinated, will help because it helps you strengthen your arm, but not putting too much pain or tension on the outside of the elbow. So bend over, hold your arm straight with a light weight, pull up towards your chest, and then down. A good cue is here is like you're sawing a piece of wood, but make sure you keep it close to yourself. Don't raise up or back too hard, and keep that elbow to your side. With tendons, you've probably heard the term tendonitis, but you may have also heard tendinosis and tendinopathy. I'm going to quickly explain what these mean and when they should be used. So we now know with research that the main driver for tendon irritation is mechanical overload. There's more load that's placed on the tendon than the capacity can currently handle, and it gets mad. And we also know there's very avascular. There's not a lot of blood supply, so when tendons get pissed off, it takes a long time for them to calm down compared to muscles. So tendonitis implies that the tendon is irritated. So this should be used when you've had pain for maybe a few days to up to a few weeks. There's an acute irritation here, and you need to let the tendon calm down. The best way to do that is not to treat it, but find what's bothering it and reduce it. Now with tendinosis, this mechanical overload has happened long enough that part of the tendon has died or become mechanically silent. So a good analogy here is think of a donut. The outside of that donut is the healthy part of the tendon, and the inside is the dead or mechanically silent part. Now the inside cannot be changed. What's cool about tendons is as we strengthen them over time, that outside of the donut will get bigger and stronger to compensate. So don't think exercises won't help, they will, and they can actually make the tendon even stronger than it was before the degeneration happened. Now the best term for tendon is called tendinopathy, and this is a continuum. It kind of explains the whole process of the acute, middle, and late stage of tendon issues, and it became Vajel-Cook. There's another condition that can present somewhat similar as tennis elbow, and that's radial tunnel syndrome. And this is a condition that involves the compression of the radial nerve as it passes through the space called the radial tunnel, which is located in the forearm. The radial nerve is responsible for providing sensation to the part of the hand and controlling muscles that help extend the wrist, fingers, and thumb. When the nerve becomes compressed or pinched, it can cause pain, numbness, or weakness in the forearm and hand. Now we're going to cover the pain and loading parameters again. So with tendon, the expectation is that there's going to be some discomfort when you exercise and rehab them. It cannot be pain-free. And remember, this is hurt, not harm. Their pain does not mean damage necessarily like a broken bone. It means you have to go slow. So some good things to think about is the pain should be mild. A 0 to 4 out of 10 or less. The pain should be no worse than 2 hours after the exercise, and the next morning you should wake up feeling the same or better. If you feel fine during, but the next morning your arm is killing you, you did too much, you gotta wait till it calms back down to baseline and start at a lower level. It's all about finding the right entry point and then gradually progressing over time. Thank you for watching our video on tennis elbow. A lot of people get mis or disinformation about this condition and then suffer longer than they need to. If you did find it beneficial, please like our video and subscribe to our channel, and then don't forget to check out our other videos.